Welcome to the news at 8. I'm Sarah Jacob, and over the next half an hour, we're going to bring you up to date with everything you need to know about your world today. First, the headlines. India sees a record high in new COVID cases, over 2 lakh cases for the second straight day. A shortage of medical oxygen in numerous states, a 2-day wait list for getting a COVID test in the national capital, and bodies piling up waiting to be cremated in Varanasi. The BJP tells the Election Commission don't shorten polls. There's no connection between a rise in COVID cases and election rallies. Assures the EC that it will follow COVID protocol. On the ground, the Home Minister takes out a roadshow in Kolkata, doesn't even wear a mask. Andhra Pradesh runs out of vaccine stocks. This 2 days after recording 6.2 lakh vaccinations, the Andhra Pradesh Chief Minister puts out an SOS to Prime Minister Modi. Karnataka reports 14,000 new cases despite experiencing COVID symptoms. The Chief Minister holds an emergency meeting on COVID. He announces he's COVID positive for the second time soon after that. COVID predominantly spreads through the air, says the latest Lancet study, and not so much via contaminated surfaces. Recommends a limit on gatherings, no gatherings of groups larger than 10 for 2 months. After thousands gathered at the Kumbh, 30 sadhus test positive, 1 dies while being treated for a coronavirus infection. 30 police personnel who were deputed on Kumbh duty also test positive. And fugitive billionaire Nirav Modi's extradition to India cleared by the United Kingdom government. He still has the option of legally challenging the order. The big story. India has reported over 2 lakh coronavirus cases for the second consecutive day. There have been over 11,000 COVID-19 deaths in the last 24 hours. This even as India is now looking to import medical oxygen amidst a shortage, and patients gasping for breath have had to be turned away from hospitals. Remember, while the United States took 21 days to reach the daily count of 2 lakh cases from 1 lakh per day, India reached that grim milestone in just 11 days. And the peak is far from over. One reason for this is that the weekly average positive rate has hit the highest. Now, this is a double whammy because daily cases are still rising at a rapid rate. And the last time the positivity rate was almost this high was 5 to 6 weeks before the first wave peak. And with COVID cases spiking in Uttar Pradesh, scenes of despair are being witnessed in Varanasi's Harishchandra Ghat, where dozens of dead bodies are piling up, waiting to be cremated. Varanasi has seen an over 1,000% rise in cases in the last 2 weeks. Cremation ghats are now struggling to cope. Tourists have been urged to stay away due to the surge in cases.
48 साल अवस्था हो गई लाइफ में ऐसा दृश्य भयावह हमने कभी नहीं देखा। सोचा भी नहीं था कि एक साथ 20-22 डेड बॉडी जल रही हैं, 15-20 लाइन में हैं, जो कि इसके बाद 10-15 ठो आपके जो इसमें लगी हुई हैं इलेक्ट्रिक वाले पे।
हम लोग भी 5-6 घंटे पहले हम लोग आते थे तो मैक्सिमम या उसको कम से कम कहिए या ज़्यादा कहिए तो 10 से 15 मिनट ही लगता था। लकड़ियाँ इकट्ठी हो जाती तो लाशों को लगा दिया जाता था, तो जलने में जितना समय लगता था। राकेश आगे तो है के लिए भैया।
And after a shortage of remdesivir in Gujarat, UP, Madhya Pradesh and Karnataka, and a shortage of medical oxygen supply in states like MP, Gujarat, Punjab, Andhra Pradesh says it's out of stocks of the Covid-19 vaccine. The Andhra Pradesh Chief Minister has now put out an SOS to the Prime Minister saying there's not a drop of the Covid vaccine left.
Okay.
Andhra Pradesh Chief Minister Y.S. Jagannath Reddy has written to Prime Minister Nirav Modi saying COVID vaccine stocks have completely run out in the state. The CM has sought 60 lakh doses for Andhra Pradesh, promising to administer within 3 weeks the first dose of vaccine to the entire eligible population above 45 years in the state. On Wednesday, Andhra Pradesh administered a record 6,28,000 doses, the highest by any state on a single day. On Thursday, only 28,000 doses could be given as the state ran out of stock. Last Wednesday, vaccination had stopped in 2 districts of Andhra Pradesh, Nellore and West Godavari, as they ran out of vaccine. Subsequently, the state was sent 6.4 lakh doses after the Chief Minister had asked for 25 lakh doses. Andhra Pradesh has vaccinated just about 5% of its population, and vaccine shortage is proving to be a challenge at a time when the state wants to expedite vaccine coverage, even as the state is reporting nearly 300% increase in cases over the last fortnight, with over 5,000 cases every single day and a positivity rate more than the national average at over 6%. With camera person Nagraju, Uma Sudhir, NDTV.
And in Delhi, it's a shortage of testing facilities. These are testing times for Delhiites. If anyone exhibits coronavirus symptoms, there could be a 48-hour-long harrowing wait just to get tested. Covid-19 testing labs are running at full capacity. They are swamped with samples, forcing many to reject requests for home collection. The results are taking days to come. And what this means is that infected people may not be isolating, may not be reaching out to those they've been in contact with recently, jeopardizing efforts to contain the outbreak.
Getting a COVID test can now take hours or even a day or two in Delhi, which is reporting 16 to 17,000 cases a day, worse than Pune and Mumbai.
Online it was taking about 3 to 4 days for us to get an online slot. So I thought let me come here and see what the situation is.
But do you believe this is a far more riskier, for especially senior citizens to walk in?
Yeah, there's a lot of gathering of people also, so yeah, it is definitely more risky.
But with a delayed time in booking a test comes delayed reports. COVID-19 volunteers NDTV spoke to did not want to be identified.
जो पीछे जब केसेस कम हो रहे थे तो उस टाइम तो 24 घंटे में ही आ रही थी रिपोर्ट।
जी
लेकिन अब सैंपल ज्यादा लिए जा रहे हैं ना, प्राइवेट से भी लोग बहुत सैंपल दे रहे हैं, गवर्नमेंट से भी बहुत सैंपल दे रहे हैं
जी,
लेकिन लैब जो है करने वाली उतनी है, तो इसलिए सब वेटिंग में चल रहा है।
बहुत सारे पेशेंट्स की क्वेरी है कि उनकी जैसी वो बुक करते हैं, अगर उनकी स्लॉट उनको 2 दिन बाद भी मिल रहा है, 2 दिन बाद अगर वो टेस्ट करवा भी लेते हैं तो उनकी जो रिपोर्ट्स है वो 24 आवर्स में आ जाती थी, बट उसमें भी काफ़ी डिले हो रहा है, जो कि 48 आवर्स में भी आ रही है।
So just to give you a sense of what it's like to book a COVID test online in these times, it looks like a difficult situation. I am trying to book a COVID test on a private lab, one of the most popular ones. I am on the website. The nearest location is what I will be selecting. So let's see if I can book myself a COVID-19 test request, and the message that I have got from here is, and if I can highlight and show it to you, we request your cooperation and patience as we are running at capacity. Let me take you through another website which also has the facility to book a COVID test online. As you can see, I'm going through the list over here, and as I try to book myself one, the message I get in big bold letters in red flagging off, currently we are not accepting any COVID RT-PCR orders. Fawad, a student in the national capital, wanted to get a COVID test done after he showed symptoms. Several COVID testing labs that we spoke to told us that they have become overstretched and overwhelmed with the response of the incoming bookings. So much so that they have had to close down their online bookings or keep callers waiting. An unprecedented health emergency, leaving many gasping for the basics. In New Delhi, with camera person Sushil Rathi, Shonakshi Chakravarti for NDTV.
And the Karnataka Chief Minister has tested positive for the coronavirus for the second time. Ironically, he held a physical meeting with his team on tackling the virus while awaiting a COVID-19 test result. This on a day when the Karnataka and Bengaluru saw record spikes in new cases, reporting over 14,800 COVID-19 cases today.
Karnataka Chief Minister B.S. Yediyurappa adding to the number of positive COVID cases being reported from the state. The Chief Minister tweeted that he was tested after developing a mild fever and was being hospitalized despite doing fine on the advice of doctors. Just before this announcement, the Chief Minister had headed a hurriedly convened meeting on COVID-19 at his residence after the state and capital Bengaluru registered record highs in terms of new cases. The city now has the third highest number of active cases in the country. But there is still no talk of lockdown and no change in the existing curbs in the state.
Corona cases is going on very high. So we have discussed in detail from 1.5 hours with our officers, and we are going to take final decision, and to that time same thing will continue.
The Health Minister said the discussion focused on clinical management of patients and how to control case numbers.
All these form of conjugations will be discouraged. Only those who are having severe symptoms, who are having comorbidity and absolutely requires medical attention, such people will be admitted only in the hospitals.
This means night curfew in Bengaluru and 6 other cities stays until the 20th of this month and maybe later. The state had a major festival earlier this week, Yugadi. Ramzan has also begun with restrictions in place. With DM Kumar, Maya Sharma in Bengaluru for NDTV.
And over 10,000 fresh COVID cases have been reported in Kerala on Friday, and worryingly, the positivity rate has risen to 14.8%. In response, the state government has rolled out a mass COVID-19 testing campaign with an emphasis on those who actively participated in the recently held Kerala Assembly elections.
At this makeshift COVID testing camp in one of the biggest government offices in Kerala, around 1,000 people are expected to get tested over the next 2 days, including officials on election duty like Anupama, who travels 200 kilometers from home to office every day and back by train.
Very important for us today is life. Massive അല്ലായിരുന്നു. അപ്പോൾ പിന്നെ നമുക്ക് അതിൻ്റേതായ ബുദ്ധിമുട്ടുണ്ടല്ലോ. ഞാൻ ഡെയിലി ഇങ്ങനെ ഒരു ട്രാവൽ ചെയ്ത് വരുന്നതാണ്. 100 കിലോമീറ്റേഴ്സ് ഡെയിലി ഒരു സൈഡിൽ ട്രാവൽ ചെയ്യുന്നതാണ്. അപ്പോൾ അതിൻ്റേതായ ബുദ്ധിമുട്ടുണ്ട് നമുക്ക്. അപ്പോൾ ഇത് ടെസ്റ്റ് നടക്കുന്നത് നല്ലതാണ്. നമുക്കറിയാമല്ലോ ഉണ്ടോ ഇല്ലയോ എന്നൊന്നും അറിയാമല്ലോ. പിന്നെ ഈ ഡ്യൂട്ടിയൊക്കെ ചെയ്തുകൊണ്ട് അത്യാവശ്യമാണല്ലോ. ടെസ്റ്റ് നല്ലതാണ്.
COVID cases in Kerala have been spiking soon after the election campaign ended a fortnight ago, with test positivity rate crossing 13%. Well, Kerala government is targeting around 2 to 2.5 lakh tests to be done in these 2 days. And even as it does that, the difference should be seen that on a regular day, it would have been around 60,000 tests. For this target, all possible machinery, including RT-PCR and antigen facilities, are being used. At this centre in rural Thiruvananthapuram, not only visible rush for vaccine, but also a mobile private testing unit for RT-PCR tests on contract with the government to extend the testing reach among masses. Across Kerala, districts vary in their capacity for RT-PCR tests from 50% to 70%. The rest would be antigen tests.
The target given for Trivandrum district for 2 days is 22,600. That means we are supposed to do the testings we usually do in 3 days to be done at 2 days, and the results will come anyway within 4 days.
Mobilizing people for such a drive is no easy task, with an army of Kudumbashri and accredited social health activists like Freena and Komala contacting scores of families.
610 ഹൗസ് ഉണ്ട്. ഈ 610 ഹൗസിൻ്റെയും ഡീറ്റെയിൽസ് നമ്മുടെ കയ്യിലുണ്ട്. അവർക്ക് എപ്പോഴാണ് നമ്മളടുത്ത് ഒരു ഫോൺ കോൾ ചെയ്ത് ഇൻഫർമേഷൻ ചെയ്യണം, ഞങ്ങളത് മേലധികാരികളെ റിപ്പോർട്ട് ചെയ്ത് അവർക്ക് അതിൻ്റെതായ ആവശ്യങ്ങൾ നേടിക്കൊടുക്കാറുണ്ട്.
Frontliners doing best what they can amid a second COVID wave. With camera person SP Babu, Sneha Koshri for NDTV.
And a new medical update in the medical journal Lancet says that there is now overwhelming evidence that the SARS-CoV-2 virus, which causes COVID-19, is predominantly transmitted through the air, and that transmission rates are much higher indoors than outdoors, and transmission is greatly reduced by indoor ventilation. By contrast, the team found little or no evidence that the virus spreads easily via large droplets which fall quickly through the air and contaminate surfaces. The new work has serious implications for public health measures designed to mitigate the pandemic. So what does this mean for India specifically, which is experiencing a second wave of the coronavirus? Well, the Lancet Commission says ban large gatherings over the next 2 months. It says one should monitor the surges in districts where people are returning from mass events. It has recommended a temporary ban on the gathering of groups larger than 10 for the next 2 months. It has said that you must monitor surges in districts from where people are returning from large events. It needs to accelerate the vaccination drive, and we should include all adults with comorbidities into the vaccine priority group. It has recommended vaccinating teachers and school staff on a priority basis, approve a broader mixing of vaccines and ramp up manufacturing capacity. Meanwhile, on the ground, a seer has now died from COVID-19. 30 others have tested positive after attending the Kumbh Mela despite a national surge in infections. Ignoring COVID-19 advice, the Kumbh Mela has been sending off alarm bells among health experts who worry it could turn into a super spreader as pilgrims return home to their towns and villages across India.
Worryingly, COVID-19 also beginning to spread among the seers or heads of religious orders who took part in the Shahi Snan on the auspicious days of the 12th and 14th. 30 seers have tested positive, the number which is expected to rise according to the Chief Medical Officer of Haridwar. Health officials who were stationed at the Kumbh now also at risk.
चूंकि अखाड़े में कई संत जन अभी बीमार हैं, कुछ संत जन हमने भर्ती भी करने पड़े, कुछ अभी आइसोलेट हैं आश्रम में भी। फ्रंटलाइन वर्कर जो भी हैं, किसी भी श्रेणी में हैं, आते हैं, सभी लोग एक्सपोज हुए हैं। इन सब की रैंडम सैंपलिंग हम लोग कराना चाहते हैं। तो पॉजिटिविटी रेट निश्चित रूप से 12, 13, 14 3 दिन में वो काफी बड़ा है।
With the COVID scare, one of the largest sects, the Niranjani Akhada, along with Anand Akhada, have said they will no longer participate in the Kumbh, and the next Shahi Snan on the 27th will be merely symbolic.
कोरोना को देखते हुए इसमें हरिद्वार में जो है कोरोना का इतनी स्थिति बिगड़ी हुई है कि जिसके लिए जितना हम कहें उतना कम है। तो इसलिए हमने ये निर्णय लिया कि हम भी सुरक्षित हो जाएं और हमारे जो भक्त लोग हैं, जो भी लोग संत लोग हैं, वो भी सुरक्षित हो जाएं।
Mahant Narendra Giri later also tested positive for COVID-19. However, the administration says the Kumbh itself is not being called off as per the notification.
जहाँ तक शासन के स्तर पे है, शासन के स्तर पे ऑलरेडी 1 अप्रैल से 30 अप्रैल के बीच का नोटिफिकेशन है। जिस परिस्थितियों में अगर कोई चेंजेस आता है तो वो चेंजेस अभी फिलहाल शासन स्तर पे अभी कोई निर्देश नहीं आया है। बॉर्डर्स में भी अब काफ़ी सख्ती से चेकिंग कर रहे हैं। जो बाहर से लोग आ रहे हैं, विशेषकर ऐसे राज्यों से जहाँ पर संक्रमण ज़्यादा है।
Meanwhile, as the cases continue to rise, Uttarakhand government has demanded 10,000 injections of remdesivir from the central government. With Dinesh Mansera in Haridwar and Akshay Dongre, Osama Shab for NDTV.
And while the COVID virus is rampaging across India, oblivious to all this, in West Bengal, campaign rallies are taking place. India's daily average growth rate of cases in April is now significantly lower than Bengal's. While India's average growth rate is about 10%, in Bengal it's about 17%. Now this higher growth rate may or may not be because of poll rallies, but the rallies and roadshows certainly cannot be helping the situation. Are you're looking at that data. Now let's look at those pictures also of the rallies held by the BJP and the Trinamool Congress today. The Union Home Minister Amit Shah, he took out a roadshow in West Bengal where he was not wearing a mask. Massive crowds seen at Mamata Banerjee's campaign rallies too. COVID caution clearly not a priority here. Politicians continue to campaign at rallies where most of their supporters are unmasked. And the other big story of the day, the scam-accused billionaire Nirav Modi's extradition to India has been cleared by the British government. Nirav Modi, who is wanted by Indian courts for fraud and money laundering in the 14,000 crore Punjab National Bank loan scam. Let's go across to Arvind Gunasekar, who's following this story. He now joins me. Arvind, what exactly does this mean? Is Nirav Modi, is India any closer to actually extraditing Nirav Modi? Because we've seen in the past, the process can take months, even years, as we saw with the liquor baron Vijay Mallya.
Yeah, Ashara, the UK Home Secretary has signed the extradition order of fugitive Nirav Modi. This comes after the UK's Westminster Court allowed the extradition plea of Nirav Modi. Indian investigating agencies probing the Punjab National Bank scam through the Ministry of External Affairs had sought for the extradition of Nirav Modi. Based on that particular request, Nirav Modi was arrested, and the UK's Westminster Court heard the matter on behalf of Crown Prosecution Service. So during the hearing, the Nirav Modi side put forth their argument, but after hearing both the sides, the UK's Westminster Court had allowed Nirav Modi's extradition. So after which the case was sent to the UK's Home Secretary, and the UK's Home Secretary has signed the extradition order. So what next? So can Nirav Modi be brought to India the very next day? No, that's not the process what we are learning from our sources. In fact, according to the UK's Extradition Act, 28 days from the extradition order being signed by the Home Secretary, the person here can move the High Court challenging this particular extradition order. So in all probability, Nirav Modi will be challenging this order before the UK's High Court, similar to what Vijay Mallya said. And even after UK's High Court order, he can again move the Supreme Court if there is an option. If not, like Vijay Mallya, Nirav Modi can also seek asylum. Comparing Vijay Mallya's case with Nirav Modi case, in Vijay Mallya's case, the UK's Home Secretary had signed the extradition order on February 2019. That is 2 years ago, but still Vijay Mallya has not been extradited. According to our sources, UK's judicial process is complicated. That's why it's taking time.
All right, thanks so much for that, Arvind. And following the Central Board of Secondary Education, or CBSE's decision to cancel and postpone the Class 10 and Class 12 exams respectively, the Council for the Indian School Certificate Examinations, that is the ICSE, has now decided to postpone the ICSE Class 10 and the ISE Class 12 exams. So these exams have now been deferred to when? That decision is expected in June. And the monsoon is expected to be normal this season, has said the government, at 98% of the long period average. Anything above 96 is considered to be a normal monsoon. The 2020 and the 2019 monsoons were above normal, and we're told Jharkhand, Odisha and Bihar are likely though to record below normal rains this year.